Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles. I'm going to stop saying guest at this point because he's with us every week.
I've made it to host status.
And he is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribe of Wisconsin. And he is here as usual to answer some of our COVID-19 questions and give us a update. So we would like to remind people that we request that you send in your COVID-19 related questions to us at podcast@mitw.org. And that's an email address I forgot to say. So Vaughn, can you just give us a recap on the press release that was just released, like literally, 10 minutes ago?
Moments ago, yes. Yeah. So the Incident Command Team and the Chairwoman's Office just released a press release, like we said, regarding some of the decisions that the tribe and the casino have made regarding operations. So these are called executive or emergency orders. These are emergency orders. Emergency Order 2 deals with the casino, and this was the Incident Command Team advising them to close. Their board met, and they decided they would follow that guideline. And so effective 5 p.m. Tonight, July 31st, until August 11th, the casino is going to close down their gaming operations, as well as the Thunderbird gaming operations. And they're also going to postpone or not do any of their food services except for curbside. There won't be any bars open at either of those locations. It'll be takeout food only or curbside. And that'll remain in effect, like we said, until the 11th. Emergency Order 3 deals with how we're going to conduct business at the tribal offices. And this requires... Oh, sorry. I probably should... There's a list. It's at all of the establishments, institutions, businesses, office, stores, and organizations operating on tribal land. So not just the tribal offices. I'm sorry. This also extends to places like Subway, the War Bonnet, things like that. And we're having those business providers limit the number of individuals they allow into their facilities at one time in order to keep everyone at least 6 feet apart and allow for some physical distancing. We're asking that everyone over the age of 5 wear masks when they're in those public buildings or businesses, and that those masks cover their nose and go down to the chin, so that full field of respiratory intake is covered. And then temperature checks are going to be also instituted. So you'll likely see things like the temperature kiosks at the facilities, or someone will have like a temperature gun. Anyone with a temperature over 100.4 degrees will, be asked to turn around and leave and not enter the facility. People have asked in the past, what happens if you see someone without a mask? Well, we've gotten to the point where this time it's going to be enforced. Violators will be fined up to $500 in cases where they're not conducting themselves accordingly as been asked. And this will take effect 5 o'clock tonight, July 31st. And this will be in effect either until the declaration of the state of emergency expires on the reservation, or until our emergency management coordinator rescinds the order. So those are the new things that take effect. So if you're out and about on the reservation and aren't exercising, or you're entering a building, remember to wear your mask. Please be considerate of others. If you have any symptoms, that you know of before you go out, please just stay home and wait until those kind of resolve themselves.
Mm-hmm. Okay. So as far as the temperature kiosk, I had seen some people concerned because, well, this was at the casino. Obviously, the casino is closing now, but I guess maybe in the future or at these other businesses, there was some concern with how this is being enforced because they had seen somebody, like one example was somebody not taking their temperature. They just walked by it and nobody stopped them, or, there was no issue for them. Right. And then the other example was somebody having like abnormal or whatever reading, and they just continued into the business anyway. So Is there anything set in place for like enforcing the temperature kiosks?
Enforcement, I believe, will fall to our police department at this time because it's an emergency order. I can double check on that. We can get more information to the public and stuff coming up in the next couple days, just so we know and we don't confuse anyone on how enforcement will take place and who will be in charge of that.
Okay. So this week we also we saw the curfew come back, and I had seen a couple of questions about that as well. So can you explain why the curfew is now back?
So the curfew was brought back, to limit the amount of movement taking place on the reservation. The community spread of COVID that we've had recently has, doubled the number of total cases that we've had. And it hasn't come from businesses and organizations. It's been private parties, it's been private gatherings. And so the idea behind bringing the curfew back into action was to limit those as much as possible. And so households, won't hopefully intermingle as much and potentially spread the disease. And so that's why they were thinking of bringing it back. I saw that you guys mentioned earlier, why 10 p.m.? They figured, it's late enough for most gatherings. And if you're doing any sort of work, you have 16 hours between 6 a.m. when it starts and 10 p.m. That's usually enough time to finish most types of jobs. It's all the daylight hours. If you're, someone that may work in the woods, should give you plenty of time there. We also want to bring up, if you do work in like a second or third shift and, you work nights, you won't be stopped for, driving home at night when it's, 3 or 4 p.m. in the morning, and that's your normal routine to go home then. And so, Chief Nakuti has brought up that, they're very aware of who is in the community and, those who work nights. And so they're going to try to do their best to, make sure the curfew is one enforced, but also not restrictive or hassles anyone who, would work one of those shifts. And so they're just trying to prevent extra spread of the disease. So that's why it's come back.
Yeah, I asked the specifically 10 p.m. question because I've seen comments like, what is COVID come out at 10 or something? Like, why 10 p.m.? Like the boogeyman. Okay, so that was a good explanation.
Thank you.
So I think you did mention an age requirement on the mask. I can't remember if that was...
Yeah, so the tribe has asked that anyone 5 or older wear a mask. There are locations, like the CDC has said that, children as young as 2 could wear masks. I attempted something like that with my son this week. It works for, 3 or 4 minutes. So that's why the tribe has said, 5-year-old children should be wearing masks. They can, keep their hands down a little bit more and leave the mask in place. And so that's why that age requirement for the masks.
Okay. And then I also had a question about the masks that have vents in them, because I've seen some people wearing those types of masks and if they're safe or not.
So it really depends on the type of mask and the type of vent. There are some masks that have one-way vents that close when you're inhaling and, provides, say, like an N95 mask with a vent will provide N95 protection when you're inhaling. But then as you exhale, the vent opens up and all of your air just gets, expelled out through the vent hole. That is a type of mask that sort of protects you, but not the community, which is the reason that they've been asking everyone to wear masks, is so that we don't exhale germs or cough or sneeze germs onto others. And so those type of vent masks don't really help as much as some of the masks that have like a fixed vent hole where various types of filters are placed into it. Those are usually a more expensive mask. They can be reused, and those can be very expensive in some cases. They're still testing how effective some of those are, because some are like carbon filters, some are static charge filters, some are just, like 3 or 4 ply filters that are interchangeable. And so they're trying to find out what's the most effective type of fixed vent filter. And so if you do have those masks, look around, do some research, see if those are going to be effective for you or not, see if they'll help protect those around you. Because right now it's a little up in the air.
What are the demographics that are most likely to contract COVID?
So if you go to DHS's website, the Wisconsin DHS, they actually have some great graphics that show this. Right now, the demographic that has been contracting it the most, or you've seen the most cases in, is actually ages 20 to 29. Makes up 25% of all cases. That said, it's followed closely behind by the 30 to 39-year-olds, which make up 17% of the cases. And then, the 40-year-olds make up another 14%. So it's seen the most in, young to middle-aged adults. Kind of makes sense. Those are the ones that are out and about the most. On the flip side of that, though, if you're looking at cases seen in the hospital, most frequently it's individuals that are 70 and over. So, the younger people aren't having as severe of cases, but they also aren't the ones that are affected the most by it because they're young, their immune system works properly. And so we're really worried about that older demographic who's affected a lot more because of the virus. So, it affects everyone fairly evenly, but the young adults are the ones who contract it most frequently, or at least have currently.
Okay, and then another one was, what about pregnant women? Like, what are the chances for pregnant women or even the babies?
So my wife asked me this a lot. She always worries about pregnant women because she's very considerate that way. So pregnant women are considered an at-risk group for being immunocompromised. Their body's going through a lot, and so they have a tendency to get sick fairly easily. That said, they still don't know if a pregnant woman who contracts COVID will pass it in utero to their baby. And they also don't know if COVID will affect like the fetal growth and development of an infant or a fetus at this point. They have speculations. They're only speculations right now, and doctors have clearly said that there needs to be significantly more research on what happens to a fetus or a baby that comes into contact with COVID while in utero. But yes, a pregnant mother should be considered someone that's at risk.
How would COVID-19 affect drug users, or can you kind of speak on that?
Yeah, so those that use drugs, whether they're legal or otherwise, are kind of at a higher risk. They are at a higher risk of contracting the virus. And they also have more serious cases than someone that's the same age and same gender. This is particularly true for individuals that smoke, whether it's tobacco or marijuana or something a little harder, because their lungs are already challenged and trying to remove excess materials that shouldn't be in there, foreign material and whatnot. And so the body has a really difficult time also combating a viral load that attacks the lungs. And so drug use, it never helps you stay healthy. And so I would say don't do drugs, kids. Yeah, don't do drugs.
So this week there seems to be a lot of debate around the drug hydroxychloroquine. Am I saying that right?
Yes, you're saying the name.
I practiced a little bit. So can you talk about that and whether it's safe and or effective in treating COVID-19?
Okay. This is going to get political. I don't want it to be political. We're going to talk science. there have been multiple studies that have come out regarding the use of hydroxychloroquine and COVID-19. Some of them have been published in very reputable locations. There's a medical journal called The Lancet. And some of those studies actually had to be retracted because the individuals that published it didn't follow proper protocol, and their data was skewed. That said, there's also some good studies out there. Here's what we do know. Here's what I can tell you. Hydroxychloroquine it's an analog, or it's derived from a material called quinine. Quinine is a derivative from various tree barks. I'm not sure what type of trees. I'm sorry about that. But it's a natural compound that's been used for literally hundreds of years. There's records of quinine being used in the Revolutionary War. It's very safe. It's very effective. It's used for a number of things. It's used for malaria in a lot of warmer climates. And the World Health Organization actually lists it as an essential medication for countries. They consider it critical. And they also found that COVID-19 has a similar method of action, or the way that it infects your body, as malaria. That said, what else do we know about hydroxychloroquine? It's been approved by the FDA for 65 years. It's not a new drug. It's safe enough for pregnant women, for breastfeeding women, for the elderly, for children, and for individuals that are immunocompromised. Here in the U.S., we mainly use it for individuals that have lupus or RA. And it's kind of interesting. It has essentially zero risk in the short term for compromising your organs. Now, you may say, well, what's short term? Can I take it for 2 weeks? Can I take it for months? No, they consider short term use under 5 years. So it's something that's really stable. It's not going to harm people when they take it. Some people and some of the journals said, well, it has the risk of prolonging your QT period. Well, what's a QT period? It's actually the way your heart functions. There's a little cycle. Everyone's seen the pictures of the little up and down arrows and stuff that represents how your heart's beating on a heart monitor. And hydroxychloroquine can prolong the gap between one of those spikes. It's just called the QT. But there's so little risk of that, doctors don't even screen for it. It's kind of like a side effect that commonly occurs, like nausea. And it's not even that dangerous of a type of side effect. So, what else do we know about it? It's so safe. It's an over-the-counter drug in places like France and Mexico and Central America, where they actually have malaria on a fairly regular basis. They just want people to be able to use it. The reason it's not over the counter in the United States is lupus and RA aren't that common, and we don't have a lot of malaria, so it just would sit on the shelf. And that's why it's not, frequently at Walgreens or at, your Walmart pharmacy. There's just no demand for it. So, talking COVID now. If you look at some of the studies that came out, one of the things that China said when they were dealing with their outbreak back in February was that hydroxychloroquine should be used for treatment. Okay, you can take that with a grain of salt, whether you want to trust the Chinese government or not. They kind of have, you could say, a spotty track record on human rights and whatnot. So there's that. You could also point to the fact that, when a lot of people were stocking up on toilet paper, about 30% of the doctors in the United States were stockpiling hydroxychloroquine instead of toilet paper. And they were asked by the American Medical Association not to do that so there wouldn't be a shortage for their patients. Okay, you can take that with a grain of salt too. It is what it is. So following President Trump's endorsement of hydroxychloroquine, that's when a lot of things kind of hit the fan as far as who was going to use it and not. It was moved, like France actually moved it from on the counter thing that you could pick up. They actually restricted it, so you would have to get a prescription for it. We don't know why. That's just what they chose to do. But here's some food for thought. COVID-19 is also known as SARS-CoV-2, which means there's also a SARS-CoV-1. And we saw that back in 2005. And Dr. Fauci actually published a paper on SARS-CoV-1 back in 2005. They found that SARS-CoV-2 is actually 78% identical to SARS-CoV-1. And they said that hydroxychloroquine was a good candidate for prophylactically treating SARS-CoV-1. Now, does that mean it's going to work for SARS-CoV-2? Maybe. It's got a good chance, is what they say. But they want to do a little more research. There are some studies out there that say symptoms can be reduced by 2 to 3 days for someone that's taking it. They also say if it's taken in conjunction with zinc or Zithromax, which is a common antibiotic, it can clear up severe cases. And I want to just say that's anecdotal from emergency room doctors that I've spoken with or conversed with and stuff during the entire term of the outbreak. Here's something to think about, and I guess you could look at this as the takeaway. People say, why didn't we handle it as well as other countries? You can look at countries like India and Italy and Portugal or Nigeria, and they don't have nearly as much COVID-19 floating around. They also have access to large amounts of hydroxychloroquine. I'm not a doctor. I can't prescribe this to you, and I can't tell you should be taking this. It may be an effective drug. Whether or not we're allowed to use it, that remains to be seen. But that's what we know right now regarding hydroxychloroquine, and I hope there's no spin on it. It's just the facts that are out there.
Well, I went in for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and you can keep up to date by following us on Facebook at MITW Podcast. And we do weekly updates with Vaughn, and we welcome your community questions or topic suggestions that you have regarding COVID-19. So please send those into us via email at podcast@mitw.org.